And so here I am. So let's start with this. I really like this interpret, visualize and respond thing, the whole idea behind this talk. And it quite nicely syncs with what I'm going to say today. So let's start. Alright, so this is interesting and this is beyond what we usually talk about. The first thing that I've written here is why is it so difficult? I'm talking about medical students and their preoccupation for the whole 5.5 years during their internship. All the time they are preoccupied with one thing, how to go to the next step, right? This is your preoccupation. And there's this whole preoccupation with the next step, getting into a good college, in a good branch. It preoccupies most of our time. And then many times I talk to students who have not been able to do so. They feel very defeated, very tired, very frustrated. That despite becoming MBBS doctors, despite getting in the probably top 1% of the population, why are you still so unsatisfied? Why do doctors keep on going from one degree to another? Medical students think that once we get into a good MBMS branch, things would be settled for us. If you talk to your PGs, you will get to know that all of them are unsatisfied, all of them want to get into MCHDM. If you talk to MCHDM, they will say that they want to go outside, do the fellowships and all. And this whole cycle of dissatisfaction continues. And there's a reason behind it. And there's a neurobiological reason behind it. The way our brain is designed kind of dictates what makes us happy. You guys must have read about or you must have come across this whole thing, the reward pathway. There's a pathway in the brain which makes us feel happy, which gives us that feeling of satisfaction. The problem with the reward pathway is it will not give you that feeling of satisfaction. The dopamine would not get secreted unless you do two things. First of all, you have to do something which is worth doing, right? And secondly, you have to do something which is tough. That is why we doctors, we medicos get into this endless loop of picking targets for ourselves or picking up on things which are difficult to do and which are worth doing, right? Getting a bigger degree, getting an advanced degree is of course worth doing, and at the same time it's so tough. And that's why I sometimes call it the Stockholm Syndrome for medicos. You know about Stockholm Syndrome, right? In Stockholm Syndrome, the captive falls in love with the person who has captivated him. And if you think about it, we hate exams. Right? None of us love the exams, but that is what we are always doing. The moment we finish one exam, the moment we clear one exam, we immediately start looking for the next exam. I am so surprised that when I get messages from the medical students, when they ask me which branch should I go in, the first question or the second question is, sir, can I do super specialization in this branch? So this is very interesting. Everybody hates that process, but they want to continue moving down that path. So we have got two things. First, our genes are not in sync with what we are doing. And secondly, we cannot feel satisfied, we cannot feel happy unless we do the difficult task. And that is the problem, right? And that's why all of us keep on trying to find the solutions. So this one was the interpretation part, the interpretation of some of the problems that we face. Let's talk about the solutions now and some of the things which are more relevant for medical students. I would be kind of focusing on the medical students in my talk. This whole issue of role models has come up big time. And I think one of the reasons behind this issue is that with the advent of technology and the YouTube and the social media, everybody is on YouTube and social media, we keep on looking for the role models. And every year the exams happens and we are flooded with the interviews of the toppers, and toppers are talking about it, how they started studying in the second year, how they started studying in the third year, and how many hours they studied for. And many of us start making them the role models because that's aspirational, right? Of course, if you're told that there's a guy who got rank 1 in INICT or rank 1 in NEET PG, you look up to that person. And sometimes while looking up to that person, you end up ignoring the person who is more important. Your senior, the senior in your college, whom you know, with whom you can relate, who has gone through the same journey that you are going through. So I often tell my students, I would want everybody who would be watching this video and to the students who are sitting here in the audience that choose the role models wisely. If you are trying to emulate your senior whom you have known, probably things would be better. The problem with trying to emulate people that you see on YouTube is you don't really know their journey. And the flip side is you may feel that you are not that good. You may have that defeatist attitude, developing in yourself. I have seen students who say that, sir, all these toppers start studying from the first year itself. I never did that, so I have no chance of getting selected. Now that's an absolutely false statement. But the problem is that the role model that you have picked is wrong. That is why you are taking out the wrong conclusions. So one advice, choose the role models carefully. The role models should be your seniors. The role models should be the people whom you know personally, and you can talk to them and you can understand their journey better. Alright, the second part of our talk is visualization. Now visualization is an extremely important tool. It's an extremely important tool, and when I am asked to deliver motivational speeches, or I'm asked to motivate the students, this is something that I love doing. Visualization is a strong motivational technique. The reason being it tricks your brain. Our brain is not so great in differentiating the reality from imagination. The brain starts responding in the same way, whether it's an imagination or the reality, and we can use that technique. When you talk about the visualization, when in the context of motivation, a great thing that works, and this works across the domains, and whether you're a medical student or an engineering student or a professional or a businessman, it works great because it kind of hacks the functioning of brain is to just close your eyes and imagine that you have achieved what you wanted to achieve. Anything that motivates you, whether it's visualization, whether it is seeing an interview of a topper, whether it is your senior, anything that generates that even a small iota of motivation should be used immediately. Where I say what next means something motivated you, the next step should be getting on the chair, opening your laptop, opening your book and taking an action. When you take that action, then you get into that cycle, that reinforcement cycle. How it works is something motivates you. After that, say you spend 45 minutes reading a book. At the end of the 45 minutes, you feel better, you feel satisfied, and then you want that feeling of satisfaction. That is how that positive reinforcement cycle sets in. You want that feeling of satisfaction again and again, and you want to do the thing again and again. And there's not only positive reinforcement, we also have the negative reinforcement working. What is negative reinforcement? What is positive reinforcement? Positive reinforcement is you want to repeat a behavior because the consequences of that behavior are positive. For example, say a student studied for 45 minutes and he was treated with, say, a chocolate. We are talking about a young student here. You guys won't get any chocolates, right? And the student wants to do that session again. In your cases, what will happen? You study for 45 minutes or 1 hour and you get that feeling of satisfaction. And that is why you want to do it again. And what is negative reinforcement? You increase the frequency of a behavior because you want to avoid a negative consequence or a painful consequence. What is a painful consequence? All of us have felt that feeling of frustration, that feeling of inadequacy when you are not doing things that you are supposed to do. When you are not studying, you know that there is something missing and you have that feeling of emptiness, or call it pain or whatever you want to call it. And when you study, that feeling is taken care of. So again, you want to avoid that feeling and you increase that behavior. So rather than going from an endless loop of motivational videos, the better thing, the thing that works is something motivates you, take an action, that action will further get reinforced, and then you get into that cycle where it's self-sustaining. You don't have to really depend on an external source for that cycle to continue. And the third part, the talk is respond. Motivation has almost become a cliche. It keeps on, we keep on repeating it, perseverance. But things that become cliche for a reason, right? Perseverance in our field or in the context that I am giving this talk is equivalent to taking the things to the end day. If you are preparing for an entrance examination, taking the preparation to the last day is something that puts you in the top 10% or 15%. This whole idea of continuing to persevere is so difficult. As a teacher, if 100 students, I know this for a fact, as a teacher I know this thing for a fact. You can just take the things to the end, probably half the battle is won. And how do we persevere? We keep on telling that let's persevere, let's not give up, but how do we do that? And how do we not give up depends upon how you respond to yourself, right? The sportsmen often say this, that the games are won between the 2 ears, the games are won in the mind. And that's very true. Why? How are you going to feel? How motivated are you going to remain? How are you going to behave? Quite depends upon what is going in your mind. Right? What is going in your mind is going to determine all of these things. And the conversation with self is going to be very important. I would not be able to do it. This is a thought, and you have to learn the art of responding to that thought. If you don't respond to those thoughts would become very powerful and they will dictate your behavior. But if you learn to respond to them, then the things get in your control. Thought came, I would not be able to do it, and respond back to it. Well, there is no reason why I can't do it. My seniors have done it. I know them by face. I know them by name. I have seen them studying. They are like me only. If they could do it, why can't I? If you can respond to that thought, I would not be able to do it. By this thought, things change. You would not lose motivation. You would not go back to hostel. You would not go back to sleep. And this is what I call as art of conversation with self. You have to talk to self. In CBT, cognitive behavioral therapy, which we do with the patients who have anxiety or depression, we try to teach them one thing. We tell them that just because you had a thought does not mean it is true. And that principle applies to all of us, not only you students but all of us. Just because you had a thought does not mean it is true. So all those thoughts, I would not be able to do it, I would never get selected, I would never get a good rank, I would never get a branch of my choice, or I would never be able to teach, I would never be able to give a talk. All these thoughts are thoughts only. How I respond to those thoughts is going to determine what I do, how I feel, and what happens next. So this whole sequence, having a thought and behaving, in between this, you have to add one thing, which is the art of right conversation with self. We have to learn to respond to ourselves in a proper way. The 10-year-old sibling rule, again something which I have borrowed from what we do with the patients. So, interesting concept of CBT, cognitive behavioral therapy, is that when we are in the middle of something, when we are in the middle of a problem, often we do not realize that the solution is right in front of us. We find it difficult to, take even simple steps, even simple solutions become difficult for us, they do not come in our mind. And that is where the 10-year-old sibling rule comes handy. Whenever you are stuck somewhere, whenever you do not know the solution, or whenever you are feeling so overwhelmed that the solution is not coming to your mind, just try to detach yourself from the problem and ask yourself, had my 10-year-old brother or had my 10-year-old sister was having the same issue, how would I respond to it, or what suggestion would I give to him or her? And when you do that, when you kind of detach yourself from the problem and when you try to see from a third person's perspective, the answer is often very clear. The answer is often right there. So the 10-year sibling rule comes very handy. If you ever get stuck, ask yourself that if it was my brother or sister was having this problem, how would I respond to that? Willpower is finite. Do not make the mistake of believing that you can, just have infinite willpower and you can just force your brain to do stuff. It doesn't work that way. And that is why if you really want to do something which is difficult, whether it is, don't rely on willpower. If you want to get rid of it, you'll have to do something of this sort. You'll have to make that behavior difficult for you. And if you do that, you'll find it effective. In a field like ours, in a field of medicine, how well you do in your life, how successful a doctor you become later on, quite depends upon how much are you in love with your subject. All the professors in your college, the good ones, if you look at them and if you try to find one common attribute, that attribute would be all of them love their branch, right? And the same thing happens in the world outside the medical colleges too. Private practitioners who are doing great, all of them are primarily doing great because they love their field. Personally, I love the field of psychiatry. I must have read at least 10 times more books on psychiatry after finishing my MD than I read when I was doing MD. And that is where this point becomes important. How will you ever fall in love with a subject if you just keep on watching notes, or watching videos, or watching notes, or reading notes? You don't fall in love with the subject by watching videos or notes. You fall in love with the subject when you read good books, nice textbook that kind of inspire you. So please, this is an unfortunate trend. I would very strongly advise not to follow this. Don't let go of the standard textbooks. They became standard because of a reason, and we should not let go of them. And lastly, entrance examinations are important, but please don't judge yourself solely on the basis of that. Please remember that who cracks an entrance exam? What are the skills required for cracking an entrance examination? I see there are two fundamental skills. The first skill is the ability to study for long periods of time, and the second skill is how good are you at rote memorization. Especially in our field, in medicine, how good are you at rote memorization is going to quite decide how well you do in an entrance examination. But when we talk about being a good doctor, being a good clinician, neither of these two skills are very important. If you talk to a successful physician, if you talk to a successful surgeon, if you talk to a successful psychiatrist, and if you ask them, do you know more than your colleagues? Do you know more than your colleagues who are not doing so well? The answer is no. All of us have almost the same amount of knowledge. The things that matter are the soft skills. How well can you talk to the patient? How well can you empathize with the patient? How well the patient can trust upon you? I want to remind you of this last point again, that keep your sight on the final target. The final target is not cracking an examination, but becoming a good clinician. And with that, I want to end my talk. Thanks a lot.